Hello all, I'm here to present the topic herbal drugs for COVID control. I'm Srivani from Center for Pharmaceutical Sciences, Institute of Science and Technology, JNTH. I'm here to present a presentation on COVID control uh, by using herbal drugs. Like the contents of the presentation includes introduction, characteristics, and diagnosis of COVID, and a various list of drugs like ashwagandha, basil, licorice, neem, turmeric, ginger, and coming to coronavirus. Like we have been seeing how the world got affected by the coronavirus, and actually these are not a new one, but the sister viruses have already been existing from past, but now the new coronavirus which has been spreading and killing many of the lives, this is a new gene, but the sister families of the viruses have been already existed uh, in the ancient times. So here the coronavirus are the large family of viruses that cause illness ranging from common cold to more severe diseases like Middle East respiratory syndrome and severe acute respiratory syndrome. Like we can see the coronavirus mainly attacks the respiratory system, like making the person weak, and the lung function is going to be reduced or somewhat affected, thereby the breathing gets in a difficult manner. So all over it can be any of the coronavirus. They are mainly focusing on the respiratory systems only. And here, a novel coronavirus, which is a new strain that has been previously identified in humans. See here, the coronavirus are zoonotic, which means they are transmitted between animals and people. And the genetic analysis revealed that the novel coronavirus is a beta variant of the coronavirus. The various characteristics of coronavirus is it is spherical or helical in shape and 600 to 200 nanometers in diameter, and it has got a long RNA without any segmentation. It is like a spiral way inside, and the surface of the virus has got some glycoproteins and nucleoproteins, and the inner side of glycoproteins are E1 and E2, and they help in adhesion of this coronavirus to the host cell membranes. And see, coming to the structure, here there are various proteins embedded with the virus. They are, it is an envelope composed of four structural proteins. The that they can be represented as SEMN. S means spike, E is envelope, membrane is M, and nucleocapsid is N. And spike protein, which is a receptor binding, helps in receptor binding and cell fusion. And envelope protein is small, and then that is not like it is just on the, you can see the small orange color spots, which are nothing but the envelope proteins. And membrane, this is M, near the transmade budding and envelope formation. Like after like it is meant to be to form a membrane for the new budding viruses. And nucleocapsid proteins that are helical, symmetrical, and includes like genomic RNA. So the nucleoside proteins, what we know, those RNA. And coming to like here, you can see the structure of the coronavirus. Here, the N protein, which is nothing but the nucleoproteins, and the spike protein, which is represented as S, which is going to used by the virus for the attaching of the virus to other host cells. And here's the lipid bilipid membrane, and M protein and the E proteins. So these are all present on the membranes of the virus. And the incubation period of the virus is about 1 to 27 days according to the immunity power of the man depends. So if the immune system is very weak, it can evenly get activated within 1 day. And if somewhat it is strong, it can take up to 1 month. Then the recovery time is 3 weeks to 6 weeks. And frequently occurring signs and symptoms of the attack of the coronavirus is fever, cough, fatigue, shortness of breath, and less commonly reported respiratory system symptoms include sore throat, headache, cough with sputum protection, and hemolysis. And how the virus infects the body is nothing but like when the virus enters the host cell, it is going to be entering into the body and release its RNA. So, like we have seen the structure, it is going to just attach to the host cell and releasing its RNA, and then uses the RNA to the host cell to create a new virus RNA and assemble the virus particles. Like all the virus particles which are necessary to create a new virus, which is nothing but the glycoproteins and the genomic material are being synthesized, and then these all get coop up, and here you can see the assembling and packing. So the new virions or virus particles are released, and then like all the daughter cells have gone emerged. So once the virus enters into the host via aerosol transmission by air, so the binding of the host cell to the ACE, this is angiotensin converting enzyme, which plays a major role in the attaching or the functioning of the coronavirus. So here it is binding to this receptor, mainly ACE receptor via spike protein, and conformational changes occurs in the protein, and viral and host cell membrane fusion happens, and then the entry of viral nucleoplasm into the host cell, and thereby RNA replication occurs and the protein biosynthesis occurs, and new body parts of the virus takes place, and transportation of newly formed particles via Golgi vesicles to cell membrane exocytosis. And the Golgi, it is going to use the Golgi complex material also for formation of these all body parts, and exocytosis is nothing but like it is going out of the cell uh, like very happily, and then it is like just a cycle. Here, it can be detected or diagnosed by various test methods, by real-time reverse transcription polymerase chain reaction (RT-PCR), commonly called, and transcription-mediated amplification and reverse transcription loop method isothermal amplification from nasopharyngeal swab. So like we can diagnose, like we are like we have seen in during the COVID period, the people got tested by swab test, like they are going to creep a swab into the nose, deep into the nose, and thereby they are going to do by this reverse transcription loop mediated isothermal amplification. Yes, we are going to check the like amplification of the virus, whether it's if it is present or not, and then by the blood test also, by using this PCR techniques, and we know how to prevent this spread of coronavirus, like we have been seeing from past 2 years. So this is maintaining social distance and wearing a mask, and avoid cloudy places and wash hands regularly. Like everybody should get vaccinated with any type of COVID vaccine, and always the rooms should be ventilated and clean, so that there should be a maximum passage of air. And when you cough or sneeze, a tissue must be be protected, and like you need to stay home whenever it is not that necessary to roam outside, and you can make a call to any health worker if you are not well. And coming to our main topic, like herbs which are related to fight against COVID. Of course, there are many herbs which are going to improve the immunity, because mainly the COVID is the situation where the immune system is getting affected. There are many herbs which are going to fight against the immune system, but these can be like theoretically explain the mechanism how the COVID virus can be suppressed in the body. First comes ashwagandha. So the botanical name is Withania somnifera. It is obtained from the roots of the plant Withania somnifera of the family Solanaceae. The chemical constituents, the major phytoconstituents in the ashwagandha is withaniferin A, withonine, and here withonine, which is dampen TMPRSS2 enzyme function, there block the spike protein's ability of SARS-CoV-2 to fuse the host cell receptor. Like we have said, like whenever the COVID is getting entered, it is going to attack on the receptor ACE2, and then it is going to show its action. So withonine is going to inhibit this function, like what entry or attaching of the coronavirus to the host cell receptor. And there are the other constituents, withanolites A2Y, and sominerol, and somniferin A. And properties of ashwagandha is like it is pungent, bitter, astringent in taste, hot in potency, pungent in vipaka. Action elevates vata and kapha, enhances strength and rejuvenates. Pharmacotherapeutical principles of ashwagandha, it is anti-COVID-19 activity has been been studied by various researchers, that we can see how it is working upon the virus to get diminish its action. Antipyretic, antimicrobial, antibacterial, antioxidant, immunomodulatory, anti-inflammatory, anti-malarial, cardioprotective, and neuroprotective, hepatoprotective action. Now, the various parts used for this ashwagandha is root and leaf, and therapeutic uses might be like it's fatigue, and going to treat fatigue, weakness, and emaciation, tumors, dysphonia, and insomnia. Uh, the dose of the powder can be used up to 3 to 6 grams. And the formulations include like many churnas, capsules, tablets, and all. Like here comes the mechanism how the Vithania can be used at various stages of COVID-19. Like if you see the stages of COVID-19, we can see in step by process the viral entry and replication, and immune balance, and cytokine storm, and hyperinflammation, vascular permeability, inflammation induced pyrexia, and multi-organ failure. So this is the series of steps where you can observe in the COVID-19 effect. Whereas the Vithania somnifera uh, can be used in each and every step. So if it is not taken in the first step also, by the rather steps in the coming steps also, if the Vithania is taken, that can have the ability to stop any of the spread or infection of virus more in the body. So in the viral entry, it can prevent the viral entry and replication by the inhibition of SARS-CoV-2 proteins, destabilization of ligand receptor complex, nitric oxide induced viral inhibition, and reduction of viral load in organs. And if you can see the immune balance, where the immune balance is getting decreased in the case of COVID, here, ashwagandha can play an important role in stabilization of immune homeostasis, proliferation of B and T cells, and the harmonization of T helper cells, response T helper 1 and 2, and improvement in phagocyte and lysosomal activity, and modulation of immune pathways. In cytokine storm, where it is nothing but the cytokines are um, where the immune property of the cytokines are getting diminished. Here the mitigation, like cytokine storm, is where the immune system is totally collapsed, that can be like regulated by this Withania in decreased levels of interleukins, and suppression of cellular expression of cytokines, and overall cytokine modulation. So where the cytokines storm is seen, there the ashwagandha can take part in mitigating or like suppressing the action of the cytokines to give the proper immune system. And whereas in hyper inflammation, it can elevate the symptoms of hyperlipidemia, interference with the inflammatory pathways, and induction of macrophage repolarizations. And in vascular permeability, it is going to maintain or prevention of apoptosis process, which is a programmed cell death, and then inhibition of HMGB or mediated barrier disruption, and inhibition of histamines. And in inflammation induced pyrexia, where we can see some sort of fevers in case of COVID, it is going to show some antipyretic effect by reducing the temperature, body temperature, by inhibiting the COX2 enzymes, and like transcription reduction in COX2 proteins, and suppression of prostaglandins. And in multi-organ failure, where you can see the neuro, renal, and cardio protection is observed in the case of ashwagandha treatment, and preventing the pulmonary fibrosis and liver injury, restoration of antioxidant property of gastrointestinal system, and normalization of sex hormones. And next, coming to the plant basil, which is nothing but the common tulsi. Here, the botanical name is Ocimum bacillum, of the family Laminaceae. Mostly the leaves and flowers of basil are used, and the chemical constituents are linalool, methyl eugenol, methyl cinnamate, phenolic acids like rosmarinic acid, quercetin, lutein, apigenin, quinferol, flavonoids, isoeugenol, vitamin A, C, calcium, phosphorus, beta carotene are present in tulsi. And the properties of tulsi are pungent, cold, it pacifies vata and kapha, and improves taste perception, which is cardiotronic and carminative. And the pharmacological principle, and it acts as antiviral, antimicrobial, antioxidant, anti-inflammatory, health promoting activities, and inhibitory activity in HIV-1. So it is already that reported. It is used in HIV also, and finally static, anti-allergic, anti-spasmodic. And the therapeutic uses of this is actually feverish illness, lung complaints. So it is actually like evident in proving some lung complaints, and this relates to the action in suppressing the COVID virus, and poor digestion, nausea, and insomnia, migration, and intestinal parasites. So it can be taken as juice of 3 to 5 ml, and of course the seed powder of 3 to 6 grams. So there are various formulations, Surasandhi, Kashayam, and Tumbavardi Vati. And here in the presence, if there is no eugenol, in the case, if there is direct cutoff of the virus with ACE, and thereby it is activating such inflammatory or some other mediators, thereby giving inflammation, fever, and arthritis. So whereas if eugenol is present, as the like major content is eugenol in the basins, so this eugenol is going to attach to the spike proteins of corona virus, and then it is going to inhibit the attachment of these spike proteins to ACE, thereby resulting in no fever or inflammation. And coming to the next plant, neem, which is called as Azadirachta indica, and the whole part of the tree can be used in many of the alignments. So it belongs to the family of Meliaceae, and various constituents are azadirachtin, nimbin, nimidol, and sterol, and marginoside. Where these properties are bitter, astringent taste, pungent in vipaka, and elevates kapha and pitta. And pharmacological action includes antimicrobial, immunostimulant, anti-inflammatory, anti-arthritic, anti-diabetic, and improves cardiovascular activity. So the property of immunostimulant can be considered in treating the coronavirus effect or infection by stimulating the immune system, where the coronavirus is going to diminish that. So subsidizing the actions of coronavirus, like neem is used, like the parts can be used like root, bark, stem, leaves, any of the parts can be used here actually. And the therapeutic uses in fever, skin diseases, cough, elevates toxicity, and diabetes also. So the fever and cough, so this like these are mainly reduced by taking neem. So the dosage that can be a bark powder or fresh use of leaves, and various formulations are present, that can be a tea or tea with the leaves, or fruits are used, barks are used, and neem oil also can be used to treat various alignments, like building the immune system. Nimba haridra kanda and nimba churna and pancha nimba churna are widely used. So in the COVID time, during the COVID period, like people uh, mm, like so this can be called as the like herbal mask, where people use the neem leaves to cover their nose and mouth during the COVID period. And the next one is licorice. So the licorice, it is obtained from the roots of the plant Glycyrrhiza glabra of the family Fabaceae, and the main constituents are glyceric acid and glyceric acid and liquidogenin. So glycyrrhizin inhibits replication of clinical isolates of SARS virus. So this can be glycyrrhizin can be suggested in COVID spreading by actually it is going to inhibit the replication of the virus in the host cells. It is sweet in taste and cold in potency, and elevates all the three doshas, Vata, Kapha, Pitta, and it is used as a rejuvenating tonic, and refreshment, and giving the vital strength to the body. And antipyretic, like it is going to decrease the temperature of the body, anti-inflammatory, anti-arthritis, anti-diuretic, and improves the strength and bleeding disorder, rejuvenating, and cardiogenic. The powder of the licorice root can be taken up to 3 to 5 grams, and Yashtadi churna and Madhu Yashtadi thailam are the important formulations of licorice. So where we have said that glycyrrhizin, or it is of course called as glyceric acid, it is acting upon the SARS COVID, like inhibiting the spreading or replication of the virus. So when the glycyrrhizin is taken, so it is going to act in the body by various functional mechanisms, where it is going to stop the attachment of the virus with ACE proteins, angiotensin converting enzymes, and then it can also act as like on endogenous interferons, thereby acting upon the virus to stop their activation, and stop their activation on immune cells. And they are of course acting upon the reacting oxygen species, so thereby these reacting oxygen species, where they are going to help the coronavirus to get replicated more, and then the pro-inflammatory cytokines are also that can be inhibited by the licorice, and thereby you can see here the lungs also, like a hyperproduction of airways exudates promotes and suppresses. So it is protecting the lungs by like not coming all these types of mediators up to the lungs, and it is also inhibiting the coagulation activation, like where the blood gets coagulated. In some cases, like we have seen during the corona, some patients, the heart patients, where the coagulation is seen and then the heart arrest is seen. So here, licorice can be used to inhibit that action also. And the next one is turmeric. Turmeric, which is obtained from the rhizomes of the plant Curcuma longa of the family Gingiveraceae. The main chemical constituents are curcuminoids, curcumin, curcuminone, curcinone, cineol, eugenol, proproniol, epiproproniol, and curcuminoids. This is Bester and pungent in taste, hot potency, pungent vipaka. Action elevates kapha vata, And pharmacological principle, it acts as antibacterial, antioxidant, anti-inflammatory, antihistamine, antiseptic, and hypocholestemic, and hydrochloric. So we can see here from ancient days, we have been seeing that turmeric can be used in various alignments as antibacterial, anti-inflammatory. So the like in during corona, the inflammatory mediators are also released, so that can be subsided by this turmeric taking. So here the therapeutic uses are bronchitis, respiratory illnesses. So, thereby, how the virus is attacking to the respiratory organs. Here the natural property of this turmeric, which is used in treating bronchitis and respiratory illness, that can be used. That property can be used in treating the coronas also, and used in bronchial asthma and tropical eosinophilia, diabetes, anemia, jaundice, skin disease, relieves toxicity. So apart from the respiratory things, these are the other benefits of turmeric, and can be taken as a powder in 1 to 3 grams. And there are many formulations, and Haridra Kanda and Nisama Kali Churna are the important formulations in Ayurveda. So if you can see, like it is going to act upon both lung protection and of course the cardiac protection, where it is going to inhibit the various proliferations stages of the virus, and how it is indirectly activating some of the other transmitters to get to function less or not to function at all. So thereby it is going to inhibit that part of the immunoprotectors, and activating them, and not to deactivate as if like the virus, and it is going to stay inactive with that immunomodulators. Like you can see here, the curcumin acts at the place of interleukins, and not inhibiting the apoptosis and macrophages, and neutrophil aggregation also is inhibited, and so thereby it is going to save the lungs, like keeping the overall activeness of the lungs, by keeping the activeness of the immune system. And here in the heart, so where infraction is seen and myocardial injury is seen and direct viral cardiomyocytotoxicity is seen in the case of attack of coronavirus, these all the properties can be inhibited by taking turmeric. And the next one is ginger. So ginger, this is also a worldwide used ingredient in all the foods and all. So these are obtained from the rhizomes of the plant Gingiber officinale, or the family Gingiberaceae. The chemical constituents are alpha curcumin, citranols, citronellol, gingerols. So the major constituents of ginger are all gingerol, and gingiberines, gingerol, gingerone, and gingerone A. And the properties and action is pungent taste, hot potency, sweet vipaka, action elevates vata pitta and improves digestion. And pharmacological principles includes antibacterial, antihistaminic, antioxidant, anti-inflammatory, hypoglycemic, bioavailability enhancer, and hypolipidemic action. So you can see what properties that can be helped out in corona attack is antihistaminic, antioxidant, anti-inflammatory. So the therapeutic uses, it can be used in case of fever, dyspnea, cough, heart alignments, reduced appetite, diarrhea, and blood and abdomen, bleeding, disorders, and anemia. The fresh juice of ginger can be taken, and also the powder can be taken. And adraka rasayana, adraka, or kandanava and nagaradikesha are the important formulations in Ayurveda. And if you can see that, these are the various stages of coronavirus, it can be acted by not only the one case. It has the it is more active in many of the cases also. like by how we said, it is firstly going to act upon the action or binding to the ACE receptors, and thereby entering into the host body. So this is by ACE expression tissues and monocyte macrophages, which are nothing but the inflammatory mediators where inflammation can be seen. And these are all the immune cells, like T Herbal cells, which are going to expression of antigen presenting cells. And these are the interleukins, or the like neutrophils, or the other inflammatory mediators are released, like where they are all going to convert to the other action, or getting totally depressed of the immune system. So these all, like you can see here, the ACE expression tissues in lungs, intestine, kidneys, and breast, where they can see apoptosis, necrosis, and pyroptosis and inflammation, of the fevers and all. And here, acting upon the various immune modulators, macrophages, and uh, T helper cells, and pro-inflammatory cytokines, and chemokines are seen, where the local tissue inflammation and cytokine storm is seen. And here, in the release of DMFS and macrophage interpolation and neutrophil infiltration, and the T helper cells activation, and the pro-inflammatory cytokine and chemokine secretion, where you can see the multi-organ failure, uh, how the like coronavirus is making the host cell damage. So here, all the activities are inhibited by ginger. So it can be like any of the expression binding to the ACE, like inhibiting the binding to the ACE receptors, or where the immune systems are going to get damaged. So the all the stages can be inhibited by the ginger. And conclusion, like these herbal medicines are not exactly a magic bullets to solve the problems of flu, but they can so like not only flu or coronavirus, and any other viruses, neither can avoid the virus infection, but may elevate the symptoms and potentially improve the general well-being of the patient. So it requires a careful assessment of whether such adjuvant therapies are justified or not. Then again, it can be only a suitable therapy at a stage when the severity of the disease is minor. Like it is not exactly that it is going to completely eradicate the virus or remove the virus from the person. Like it is going to inhibit some mechanisms of where the whole coronavirus is actually replicating, or increasing its number and spreading all over. So those symptoms can be subsided, and some of the symptoms of the virus attack can be relieved, or can be decreased by the herbal medicines intake. But it is not like the totally it can prevent the attack, or prevent whole of the things. That is not a sure thing. So, but like people should get vaccinated and follow the norms of COVID rules, to decrease the maximum spread of the COVID in future also. Like proper maintenance, hygienic conditions should be maintained, and the food whatever we take, that acts as a magic foods, like flavonoids or antioxidant rich content foods, so which are going to keep the body healthy, where all the free radicals, or that should be diminished actually, to maintain the immune system. Various herbal teas are also there in the market, and In related to the plants, there are various chavanprash, or which includes more than 30 like extracts in it, herbal extracts in it. So this all can be treated to build up the immune system of the person. So thereby, like I conclude here, the various herbs used in COVID treatment or prevention, or a little bit subsiding the symptoms. So the references, like from various articles, I have taken the like information, and also from the like Ayush. And thank you.